Welcome, everybody. Welcome to another episode of PEM Rules, the Pediatric Emergency Medicine Podcast. I'm your host, Yaron Ivan, as usual. And today I'd like to share some more important rules and clinical care tips so you can think about them when you take care of your patients. Rule number 200: think about the patient's future ED visits and prevent them if you can. So, one of the things I try to do whenever I see any patients in the pediatric emergency medicine department is to think about, is there a possibility this patient will show to the pediatric emergency room if I miss something or if I omitted something from my anticipatory guidance? Is there any way I can possibly prevent any future ED visits? Sometimes that entails checking more than one cause of the fever. For example, when the classic 8 months old, especially if it's a female, shows up to the pediatric emergency department with high fever, really in normal, healthy, vaccinated kids, it comes down to maybe UTI, maybe pneumonia, and if those two are negative, it's almost always a virus. So many times the child has, let's say, respiratory symptoms, never had a UTI before, very low risk. However, by ruling out UTI today, number one, I can almost definitively rule out bacterial infection, again, given the patient is healthy, vaccinated, and the chance of bacteremia and meningitis is so low. And more importantly, maybe I will put the parent to ease so they don't have to come back and they have, quote, nothing to worry about anymore. So sometimes that means expanding my workup, even if it's not medically necessary, as long as it's not abusive to the child and I'm not engaging in some big workup that entails CT, radiations, etc. Something that I'm happy to do in order to possibly prevent the future ED visit. Some parents come to the pediatric emergency department with a very big concern about a fever, and although it's not in any way indicated and certainly does not change the management, if I test the child with the respiratory viral panel and the parents get an answer, that puts them at ease and hopefully they don't seek any more future medical attention because they got the answer they wanted. Again, the respiratory viral panel rarely, if any time, changes the management, and it's really never a very helpful test, but if that put the patient or the parent at ease so they don't come back to the pediatric emergency medicine and they stop worrying, by all means, it is something that I'm happy to do. That goes back to rule number 56, worried parents don't go home. It's never a good idea to send the worried parents home because likely he or she will come back with the child, or even worse, go to a different pediatric emergency department or any emergency department, and the whole thing just restarts because oftentimes the EMRs are not shared and the provider who sees the patient has no idea what you did before. Along the same lines, if the patient is in the ED for a long time and the parents request some test that the PCP might have done or was going to do, like checking CBC for anemia or checking iron levels, if the patient is already in the ER for a long time, if the patient is already getting an IV, it's something that I am personally happy to do, again, to save that parent another lab visit or another medical visit of any sorts. So remember rule number 200. Think about the patient's future ED visits and prevent them if you can. Rule number 201. Take the child's complaints seriously. Now, this is one of those rules that is really easier said than done, especially in the end of the shift after seeing so many patients, especially after a very long day, especially when this is your third or fourth shifts in a row, especially when you've been doing it for quite a few years and you're very, very used to seeing benign complaints that are false alarms, etc. But this is probably one of the most important things you can do when you see your patients. And there's several reasons for that. Number one, I think as an ED doctor, it's always a good idea to assume the worst case scenario, as rare as unlikely as it may be. This way, you are trained to do what I feel is the most important job of the pediatric emergency medicine or emergency medicine physician. Remember, you are here to rule out serious, surgical, life-threatening, as rare as it may be. So including that in number one in your differential, as unlikely as it may be, is very, very important. It's very important for you, it's very important for your clinical care, and it's just a good thing to get into the habit of doing. Now, with regards to patient satisfaction and all that, it's always a good idea to assume the worst case scenario so you can take the child's complaint seriously. So again, always include it in your differential. Every kid with abdominal pain is appendicitis until proven otherwise. Every fever is meningitis until proven otherwise, etc. This way, you trained your mind to rule out the most important and serious stuff first, which is what really we are all supposed to do. The second reason is, remember, what sounds to you as benign may not be so benign to the parent or the patient. It actually might be a very big burden for them. The classic example is the child with abdominal pain for 6 or 7 months with really no red flag that you as a physician are not particularly worried about. The kid is not losing weight, there's no bilious emesis, there's no bloody emesis, there's nothing to indicate that this is IBD like fevers or rash, etc. But you gotta remember that for the patient, for the parent, this can be a very big deal. Abdominal migraines are a true medical condition, and the child may be physically suffering. In addition, he or she may be losing school, dropping grades, maybe having difficulties socially, etc. So, again, what medically does not seem significant to you because it's not surgical or not serious may be very serious and very significant for the parents. So, remember rule number 201: take the child's complaints seriously. It's good for you as a medical provider, and it's good to be a compassionate individual and recognize that for the parents and the patients. Rule number 202: validate the patient and the parent's concerns. So, this is obviously very related to rule number 201, and that is sometimes also something that is very hard to do. Remember, what sounds to you as benign or no big deal for the parents may be very, very significant. Recognize that the parent is scared of the fever, even though you know fever is a normal physiologic process and that specific child in front of you probably has a virus and nothing else. Many parents are very scared of fever. They are concerned that the child is going to have mental retardation. They are concerned the child is going to die. They are concerned the child has meningitis, etc. It's often a very, very important thing to validate the patient's concerns, again, even if they seem ridiculous to you. And as cheesy as it may sound, saying something like, Mom and Dad, I completely understand how you feel. That must be very scary for you. I totally understand. Can go a very, very long way. Again, even if it's hard to do because you know the child in front of you has nothing but a virus, the fever is not that high, and physiologically, medically, this child is fine. Sometimes parents come with concern that a different provider, nothing to do with you or your hospital, did not take their concerns seriously. I find myself very often apologizing in behalf of the PCP or the other ER doctor that saw them and maybe did not taking seriously, quote unquote, even though I was not involved. So saying something to the extent, Mom and Dad, I'm really sorry that you feel the PCP did not take seriously. Let me see what I can do. Maybe we can do some blood tests today to help you alleviate the concern. Or maybe I can provide you the number for the specialist and you can give them a call and go ahead and see them. Again, I try to be professional and not to throw any physician under the bus. But if the parents feel that a different physician did not take them seriously, obviously you were not there, you're not part of that conversation. But you can show the parents that you are taking this seriously and you can show the parents that you are doing something about it. And that can go a very, very long way. Again, remember, worried parents tend to come back to a different physician or a different ER and seek more medical attention. So validate the patient and the parent's concern can go a very long way in preventing future ED or any medical visits. You got to be attentive, you got to listen, you got to show that you listen. And again, sometimes in a busy shift, it's easier said than done. Always try to do it without throwing any other physician under the bus. And that is it for today, guys. Thank you very much for listening to PEM Rules. Let's review briefly what we learned. Rule number 200: think about the patient's future ED visits and try to prevent them. Can you expand your differential and your workup, even though it's not particularly medically necessary, just so you can prevent another ER visit and put the patient to ease? Take the child's complaints seriously. It's always a good idea to assume the worst case scenario so you can rule that out, even just with history and physical. And again, it's always something that is good to do in order to remain compassionate in what we do and listen to the parents. Alleviate the parents' concerns, remembering that worried parents just come back. Rule number 202, validate the patient's concerns or the parent's concern. Sometimes what seems to you like benign often generates a lot of concerns and a lot of worry, and validating that, even though that you know medically there's really nothing there, goes a very long way. It puts the parents to ease, it prevents future ED visits, it prevents a lot of frustration, and it's just good clinical care. Again, easier said than done, especially at the end of a very long shift. And that is it for today, guys. Thank you very much for listening to PEM Rules. Thank you for reading my articles on EP Monthly. Please check out the website, check out the store, check out all my links, and see if there's anything you want to contribute to PEM Rules by coming on the show, sharing your rules, or sharing some interesting patients you've seen. I'm always happy to have you. This is one of my favorite solos by Audioslave, which used to be Rage Against the Machine, one of my favorite bands. Tom Morello is one of the best guitar players out there. Hope you like it. Have a great day.